had prior surgery on my left foot twice, and I thought maybe because I was in the boot for so long and I was teeter-tottering, and I thought that was why my hip started hurting.
Miss Ford came to us with complaints of right hip pain, actually in her groin, for many, many months. She noticed it after she had had foot surgery, and she started walking a little differently. So she came to us with, those complaints, and we took x-rays of her right hip and found that she had pretty significant arthritis in the right hip. So we discussed with her the direct anterior approach for total hip replacement. The direct anterior approach for a hip replacement, the incision's actually made on the front side of the hip. You don't have to take down any muscles, so recovery time for patients is actually a lot quicker. We also don't leave you with any restrictions after surgery, so patients ask, what can I do after my surgery with my hip replacement? Well, you can ride horses, you can ride your motorcycle, you can cross your legs, you can get on the floor and play with your grandkids. We really don't tell you can't do anything after the surgery with the hip replacement. The posterior approach, the incision's made on the back side of the hip. You do have to take down muscle to get to the hip joint. So the recovery period's a little bit longer for patients. You're also left with a few more restrictions after surgery. Another benefit of the anterior is it's an overnight stay in the hospital. You're there for one night, whereas posterior, you're there for typically 2 nights.
I had surgery August 12th, 2015, and 2 months later, I'm walking without walker, wheelchair, assistance of any kind. I've gone back to my normal duties at home as a wife, as a grandmother, and I stay on the go a lot. My husband is a minister, and we travel a lot, and I am back to my old self.
Typically, patients that have an increase in hip pain, that can be, difficulty walking, specifically if they're having groin pain, not so much on the lateral aspect of the hip or the side of your hip, but actually in your groin. Also, my telltale sign is if you can take your ankle and put it on your knee and kind of relax the leg as if you're crossing your legs, and that doesn't cause you any pain or discomfort, or you don't have difficulty doing it, then we know your hip joint's okay. If you have difficulty doing that, you probably need to be evaluated to see if you have arthritis in your hip.